Welcome back to Hebrew Primetime News. As I had promised you earlier, today is World TB Day, and of course, not many people would be recognizing that because of the pandemic of COVID-19. But of course, there are more people who die every year due to TB, especially with the statistics getting up to 4,000 dying from TB. And of course, this is something that we would not want to forget. And joining me on set tonight is Timothy Wafula, who is a human rights lawyer. We'll be looking at the legal aspect of dealing with the isolation of patients of TB, and of course now in this case with isolation of patients of COVID-19. Asante sana, Timothy, for joining us tonight. Just even before we get into the whole legal aspects, let's just differentiate between TB and of course COVID-19. There are some similar symptoms.
Okay, thank you very much. So to start us off, yes, as you've rightly put, today is World TB Day. It's a day that we are reflecting on the gains and also the challenges that we have faced in relation to tackling TB. And TB, as you've rightly put, is a big global epidemic. Many people have been affected, yearly dying. And right now we are faced again with a new challenge in relation to COVID-19. And as you've said, to a big extent, there's some similarities in how both these are being manifested, with how that they are both very infectious, and and also that some of the measures that need to be put in place to or that have been used in trying to prevent TB are also some of the measures that are also now being put in place or that are being used trying to prevent COVID. So for instance, isolation and such measures.
All right. When you talk about isolation, there have been cases of people being criminalized or patients being put in prison or isolated in prison for failing to take their medications. And in this case, we've seen even people who have been told to quarantine themselves, self-quarantine, but they have been reckless about it. What do you think should be done again with this?
Okay, so with TB, the issue of isolation has been an issue that has been coming up. So, for instance, previously in Kenya, the practice was to incarcerate TB patients, and Kelin, an organization, a human rights organization that I work for, took upon this issue, challenged it in court with the argument that for public health issues, we need to take a public health approach rather than a criminal approach in addressing the issue. So the argument was that we need to put the person who is affected by TB at the center of the response, try to support as much as possible the person to be able to adhere to medication, try to support them to ensure that they are able to undergo treatment successfully, rather than using criminal sanctions as a first point of of the response. So in this case, the argument was that isolation in prison was wrong, and of course the court agreed with us and said that isolation in prison is unconstitutional, it's illegal, and we need to have we need to have a rights-based approach to these issues. And I think the same is also being manifested in the COVID-19 response, whereby...
Are you trying to understand the reasons why this person may have chosen not to take their meds, and instead of forcefully making them take their meds? But for this case, for example, self-quarantine, I mean, this is a pandemic, a global pandemic, and of course, you're making people at risk of getting the virus. Of course, I mean, would you argue the same of TB and COVID-19? Would it be the same?
So yes, to a big extent. So with the TB, the problem that created that issue of isolation in prison was the lack of a policy guiding isolation. So, and that was an aspect that was addressed by the court, whereby the government now was compelled to come up with an isolation policy. Right now we have an isolation policy that now guides situations whereby we need to isolate a person with TB. So, and this policy also now outlines is a rights-based policy that puts in consideration what are the rights of the patient, how do we support the person affected by TB to ensure that they adhere to their medication and undergo treatment successfully. So the same thing would be ideal or is needed in the COVID-19, that there needs to be clear policy. If we're talking about self-quarantine, do people understand what is this self-quarantine? What does this self-quarantine mean? Do people, if we're talking about isolation at a government facility, do people know what is happening during the 14-day period of isolation? So again, it's the same thing, that there is need for clarity, and if measures are put in place, they need to be measures that are helping and addressing the public health concern that we have at that particular point.
All right. And of course, there's this thing of people traveling and using public transport. Of course, there are those people who are feeling like, I need to go to work because I have to fend for my family. There are those people who work on hand to mouth. They rely on daily wages, to fend for their families. But do they also have rights, considering that, some of them, they're feeling that they are being forced by the government to do something they're not, yet they're at greater risk of getting coronavirus.
Okay, thank you. So in that instance, maybe what for now we can say we applaud the government that to a very big extent the government has tried as much as possible to make information available about what COVID-19 is, and also the media has played a very big role in trying to disseminate this information, telling people these are the measures that you need to take to protect yourself, to protect your families, and to prevent further spread of COVID-19. That's commendable. So I think in that same spirit, what people need is proper information, that if we are dealing with a pandemic and these are the measures that are being put in place, then if we have concerns, what is the government doing to address these concerns? So genuinely, economic issues are legitimate concerns. People want information. What are these contingency measures that the government wants to put in place to support people, for example, economically? People want information. How do I go for testing? How do I access services? How many testing centers are there? So with proper information disseminated to the public, such that the public understands, is engaged, and participates in the response, we will be able to achieve greater results, rather than, for example, if this is not, I think, a time that we say we are adopting dictatorial or throwing away democracy. No, people need to be engaged to understand, and we'll be able to achieve
and
better.
Speaking of engagement, Timothy, let me ask you, by the time coronavirus case, the first one, was confirmed here in the country, of course, in Africa, there were some cases that were confirmed. Do you feel like the government delayed in informing everybody? Because when you go to some rural areas or even to some informal settlements, people are still in denial that coronavirus, up to last week, people were still in denial that it is actually here. People were saying this is a disease for the rich. It's not here. So do you feel like there was a lapse somewhere?
We can look at it in two ways. So for one, we can say that maybe to a big extent the government reacted and started trying to come up with something when we had the issue of the plane that carried 239 passengers landing, and also that the committee was set up as a result, or because there were court cases that were coming up, for instance, a case by the Law Society of Kenya. So we can say to an extent there might have been delay in information, but now moving forward, what do we need to do? How do we ensure that we are reaching everybody, both urban setting, rural setting, with the right information, that they know we are at a big risk of COVID, and these are the clear measures that are being put in place to address them. So, and I think now we go back to the issue of information. What kind of information is available? So if I'm in a rural setting, how do I access services, health services? And I think it's the same instance with TB, the concern with TB, that with TB, a few of the legal challenges that existed were people accessing timely testing services, for instance. So with COVID, how do I access timely testing services for COVID? How many testing centers are there? What's the capacity in our healthcare system to be able to provide treatment? Do we have adequate number of healthcare workers, and all such measures? So a very big issue revolves around providing proper information and engaging the public in the response.
Okay, and even talking about information, we have that aspect of, we saw someone last week or the week before being arrested for disseminating misinformation. Now, what does the law really say about spreading misinformation? Because this is a pandemic and you don't want to cause panic and fear among people.
Yes, now that you mentioned that, now drawing from the TB experience again, we know that people with TB have been facing a lot of stigma. And discrimination. And to an extent, we are seeing some of this stigma and discrimination being extended in the COVID-19 response.
Yeah, that's right.
Yes, so how do we want to ensure that there's accurate information there, that we are curbing stigma and discrimination? So yes, so looking at misinformation, why are we having misinformation existing? So this might be coming up due to a gap that is there, and if this gap of information is filled, then we will not have channels or an opportunity for misinformation to thrive. So yes, so for me, I will say, instead of focusing our attention on curbing, for example, misinformation, we should be focusing more attention in providing the right information, supporting people, eliminating stigma and discrimination. We've seen instances whereby there are people who want people affected by COVID to be mentioned, the privacy, confidentiality to be mentioned. So should our focus be on that, or in trying to put in place measures that will ensure more prevention, and if people are affected, that the corona, COVID does not spread. So that will be my
Now, tomorrow they are supposed to launch the distribution of sanitizers to every person. But accordingly, there was also that aspect of them selling these sanitizers. Of course, they will manage, I think, to give 2 million pieces to people, especially in informal settlements. And of course, we've been having challenges of such areas with lack of access to water, of which this is a right for every Kenyan now, especially right now. What do you think? I mean, what is your opinion on that? Because
yes, so on this again, I think this is where also the media and every citizen needs to that in this pandemic, we should not stop playing our role in holding the government accountable. We should constantly be monitoring if there are resources that have been allocated in helping to prevent COVID, how are these resources being utilized? So, and again, how is the government putting, what are the measures that the government is putting in place to ensure that there's further, that the further spread is combated. So yes, social economic rights, access to water, access to housing, these are genuine concerns by the people. And as at now, we cannot say we have seen any clear plan on how the government is ensuring that people have easy access to water.
Yeah.
That how if we are talking about self-isolation or staying at home, that the housing issue is
Exactly.
covered.
Yeah.
Food situation in the house,
Yeah.
in the homesteads,
It's
employment concerns by the people. So some of these things we still need
There's
to.
a gap.
Yeah, there's still some
Yeah.
gap that needs to, the government needs, or and with support and with participation of other stakeholders, need to come out strongly and provide that informational leadership.
Okay, last but not least, do you think if the measures that are being taken for COVID-19 to fight the spread of the disease, if they were taken for TB, do you think we'd have less cases? Do you feel so? As we wrap up.
Yeah. So for one, I will say with proper information, of course, people are properly informed about the issues. That one really helps in spreading, in curbing further spread. If there's access to health facilities, access to healthcare services, access to diagnostic tools, access to testing, that stigma discrimination is eliminated.
Yeah.
If all these measures are put in place, then definitely we'll be able to end TB, and again, this one in extension with COVID-19, we'll be able to also to achieve greater success in that situation.
All right. Thank you very much, Timothy Wafula, for all that information. Of course, I do hope that being World TB Day, of course, I hope that these cases will reduce as well, even as we fight to the spread of the coronavirus. Let's take a very short break. We'll be right back with more news.